This PowerPoint is going to give you information on your basic guidelines for documentation. The objectives for this presentation are to list the components of the patient-client management model that need to be documented in the medical record, identify tasks that can be documented by the PT and those that can be documented by the PTA, discuss the basic principles of documentation, correctly document late entries and how to appropriately correct errors when you have written medical records, and then follow appropriate guidelines when creating physical therapy documentation. We already know at this point that documentation in physical therapy occurs with the initial examination, the interim documentation, which is your daily notes. It could be a progress note, or it could be a reevaluation or a reexamination, and at discharge. We've also been over this, but here's a condensed version. We want the PT record to reflect the patient's condition or pathology. Want to include those impairments and functional deficits, their goals, and their expected outcomes. The interventions provided, that could be patient education, communication with other disciplines, or procedural interventions, which is what we have been learning so far in TheraX 1, Modalities 1, and now you're learning in Modalities 2 and TheraX 2 this quarter. And then the final outcome. What are the results of the intervention that you provided? This is a good list of the basic principles of documentation. You need to be timely. All entries made in the medical record have to be relevant, thorough, accurate, and logical. We want them to be clear and concise. Concise is something that you guys will develop when you first start writing notes. It will not be concise, and don't worry about that. We need to be consistent. We need to use objective language, including facts and observations, and avoid making subjective remarks. So an example of a subjective remark would be that you would document in a record that the patient was drunk. You don't know that he was drunk without doing a blood test or a breathalyzer or certain tests, but you can instead describe objectively how the patient was walking and talking, or that you smelled alcohol on their breath. Saying that the patient was drunk is a subjective remark. And you guys will learn the difference between subjective and objective as we progress through this class. Okay. Other basic principles include writing legibly, using black permanent ink, using scientific medical terminology, describe how you use your skills to assist the patient, and using only industry standard, facility approved medical terminology, symbols, and abbreviations. So this is really going to depend on your facility. I kind of already alluded to in class that third-party payers may not know what SBA stands for. So what we will be practicing doing is writing out everything. We will not really be using abbreviations, but you guys still need to know what abbreviations are, so you can read and understand other therapist notes and also medical record entries by other healthcare professionals. Okay, other basic principles for all the notes that you write. You don't want to write in the first person. A brief review of writing in the first person is saying I or we. The second person is saying you did it. And then in the third person, you say he, she, or they. We usually use the language the patient did or client did. So, like the slide says, third person is preferred because you want the emphasis to be on what the patient can do, but still, we don't want to forget how to document what we're doing is providing skilled care, and we do that by using verbs facilitated, stretch, inhibit, apply. So an example of that would be patient ambulated 30 feet with the forward-wheeled walker with the PTA providing minimal assistance and manual cues at the right quadricep for extension during the stance phase of gait. So kind of a long-winded example, but that shows how you can write in the third person, but then again, not forget how to write what you as a PTA are doing to make it a skilled care session. You need to avoid skipping lines in a written medical record. We'll go over that in class. Use headings. That makes things easier to find. And when there's a lot of data that can become confusing, we want to use tables, columns, or lists. And I'll have an example of that on the next slide. Okay, more basic principles. You don't want to write in the first person. When you write in the first person, you are saying I or we did something. When you write in the second person, you are saying you did something. And when you're writing in the third person, you say he, she, or they. And in documentation for physical therapy, we actually say patient performed or client performed. So like the slide says, you do use third person because you want to emphasize what the patient can do. But again, we don't want to forget to document how what we are doing is providing skilled care. So we will use words like the PTA facilitated, standing by, etc. The PTA provided stretching to the right shoulder in all planes of motion. PTA inhibited the upper trap from elevating and performing normal scapulohumeral rhythm. So more basic principles. You want to avoid skipping lines in the medical record. We'll get to that more as we are actually writing the SOAP notes. You want to use headings to make things easy to find. And when there is a lot of information you want to get across or data, you can use tables, columns, or lists. And I have an example of that on the next page. So here's an example of a table where you're trying to get a lot of information across, but in a very succinct way with range of motion. That's very common. We'll also do that for manual muscle testing. And a doctor or a third-party payer just looking at this can see the improvements that the patient has made throughout their time in physical therapy. So there are some guidelines for documenting late entries. First, you need to know that the original note should never be rewritten. Instead, you do a late entry. There's also things called addendums, which is when you forget to write something in the note and you just get done writing that note, you can go ahead and put an addendum to 7, 15, 18, and go ahead and write what you forgot to put in. But in the case of a late entry, when you've done some other notes between the original one and the one that you need to add to, you can also write late entry for whatever date that you want to add your entry for. And you go ahead and put your information in and include an explanation for the late entry, and then you sign it and date it the date that you entered it in. Sometimes as we're writing, we will make errors. That is okay. When you have an error, you do a single straight black line through the text, and then you need to initial and date right next to that error. You don't want to try and cover up what you did. So you don't scratch it out a bunch of times or scribble over it. You just do one single black line and then sign your initials and date it. So below is that example. The patient ambulated, didn't want that word, have the initials, the date, and then transferred with MinAssist ×1. So another time you might find that you are documenting in the wrong chart on the wrong patient. That has happened to me. It happened to my PT school instructor. I remember her telling us about that. If that ever happens, you will draw a straight line through it. You can depend on the facility. Instead of drawing a line through everything, I just might do one diagonal line through the whole thing. Initial date and write wrong patient. So don't be surprised if that can happen because you will be busy in the clinic and be seeing a lot of people. We need to date and authenticate all patient records. What that means is we need to sign our name at the bottom for you guys right now, your first name and your last name, comma, then SPTA, and you need to date it. So that is why we already started getting you in the habit of signing and dating things in your previous practicals when you did have to document, because that is one of the things that you need to do. You also need to document reasons why there's canceled or missed appointments, whether it was the patient refusing or not feeling well, the PT or the PTA canceling the appointment. Sometimes it's also the weather. You definitely want to make note of that. And then document all telephone or internet conversations related to patient care. In those last 2 bullet points, that's where you're going to use that narrative form of documentation. You don't need to go through all the SOAP to say that they canceled their appointment or they refused. This slide talks about documenting any unusual or unexpected situations or results. My example is when I had the patient come in who had fallen that morning, and he had gotten to physical therapy with the help of his housekeeper. He got in, he sat on the bed, he was actually seeing the PTA that day. He told her what happened. The PTA appropriately came and got me. I did an assessment on him. I had him stand. When he stood, he could not stand on the other hip that we were not working on, and then that's when I proceeded to call EMS or 911, because I kind of suspected that he possibly had broken his hip. So even though we didn't see him for a treatment that day or charge anything, that was something I definitely needed to document on. The second bullet point is you need to make sure each page has the patient's name, patient number, and their date. You'll probably find that more with written records and medical records. Computer records are already going to have that information attached to them. If a lot of times when you are doing paper copies, they'll have stickers that you put on, so it is identifying that that's the patient's medical record. And if you have to go on to the next page, you want to put in parentheses, continue on the next page, and then at the top of the next page indicate what section you were at so it's easier for the reader. These last 2 slides are about documenting patient care, and again, we're going to go much more deeper into this when we get into exactly what goes in subjective, objective assessment, and the plan sections of your note, but we'll just briefly go over them now. So you want to include subjective information that helps demonstrate the patient's status. They give a good example here on this bullet point. Another thing might be my knee was really sore after I went grocery shopping yesterday, and it had swollen up. So even though that wasn't showing an improvement in progress, it's showing that that person still needs therapy and their knee is not healed yet in the terms of like a total knee replacement or any knee after surgery. So you want to record measurements of their impairment, activity limitations, and participation restriction. You guys have been hearing this consistently. That's how we're going to talk about the patient, is in terms of that ICF language. And then you want to include changes in any objective and measurable findings as they relate to the initial evaluation. Basically, the objective findings of the PT on that initial evaluation and those tests and measures are going to be things that you repeat as you are providing interventions to the patient. You will probably all the time demonstrate or document the patient's reaction to the treatment, whether it was positive or negative. How is that intervention affecting their function? And in this case, the example, their impairments. You want to include all aspects of the intervention, the treatment you provided any patient education. That is something I know Medicare likes to see, is when we are educating the patients on how to take care of themselves, and any collaboration or communication with others, which could be other healthcare providers, it could be with the family or a caregiver. And then you want to document the intervention without being repetitive. And my example of repetitive is when back in the day when I didn't have to write very good notes and I was in an outpatient orthopedic clinic and I just wrote therapeutic exercise per treatment log. And I did that probably almost every time in the objective section. I might add a little bit more here and there. That is repetitive, and that's going to just show a third-party payer that you're doing exercises over and over again each time you see them. So again, we really need to pay attention to how we're writing things to show that our intervention does require the skill and the education that you guys are receiving.